If you're looking to protect yourself from HIV, you might have come across a medication known as pre-exposure prophylaxis, or PrEP for short. So, how does it work and what can you expect when taking it? Let's dive into the details. So, what exactly is PrEP? Well, PrEP stands for pre-exposure prophylaxis, and it's a medication that you can take to reduce the risk of getting HIV from sex or injection drugs. How does it work? When you take PrEP consistently, it builds up in your bloodstream and helps to prevent HIV from establishing itself in your body. This means that if you are at ongoing risk of HIV infection and you don't already have HIV, PrEP may be an option for you. When taken properly, PrEP is highly effective at preventing HIV infection from sex, with a 99% success rate. However, it is less effective at preventing HIV infection for those who inject drugs, with a risk reduction of about 74%. It is important to take PrEP as prescribed for maximum effectiveness, as the risk of infection is higher if not taken as directed. Overall, PrEP is considered very safe, with no reported serious problems in people who take it. PrEP can be taken as a daily pill or a bi-monthly injection. There are 2 pills approved for HIV prevention, Truvada and Descovy. Truvada is recommended if you have a risk of HIV from sex and injection drugs, while Descovy is recommended if your risk is mostly through sex. If you were assigned female at birth and your risk of infection is through vaginal sex, your doctor may recommend an option other than Descovy. The Aprutide shot is recommended if your risk is through sex and you weigh at least 77 pounds. However, PrEP shots are not recommended if you inject drugs. It's important to note that PrEP is not for emergency use after HIV exposure. If you were exposed to HIV in the last 72 hours, talk to your doctor or emergency room or urgent care provider about post-exposure prophylaxis, PEP. PrEP functions by preventing an enzyme that HIV requires to reproduce from doing its job in your body. Once you begin taking PrEP, it builds up in your bloodstream and mucous membranes, providing you with protection against infection. After starting PrEP, it may take a few days for the medication to start working. The time it takes to work depends on the type of sexual activity and certain factors. For those who have receptive anal sex, it may take about 7 days of taking a pill every day. If you have receptive vaginal sex or take injection drugs, it may take 21 days of daily pills. It's unclear how long it takes to work for insertive anal sex or insertive vaginal sex, and doctors aren't sure how long it takes for PrEP shots to work. If you take PrEP on demand, you need to take 2 pills 2 to 24 hours before sex, then 1 pill 24 hours later, and another 24 hours after that. It's important to talk to your doctor about your sexual practices so they can advise you on how long it will take for you to be protected. If you're interested in starting PrEP, the first step is to talk to a healthcare provider who can write prescriptions. Before starting PrEP, you'll need to get an HIV test to make sure it's the right choice for you. If you already have HIV, taking PrEP medication could make the HIV treatment less effective. If you can't visit a doctor's office, you may be able to use telehealth services for appointments and to order an HIV testing kit. Once you start taking PrEP, your doctor will schedule regular office visits for HIV tests, prescription refills, and check-ins. If you need help finding a healthcare provider or more information about HIV self-tests, you can visit the CDC's HIV service locators. Some people may experience side effects from PrEP, such as diarrhea, fatigue, headache, nausea, skin rashes, and stomach pain. However, for most people, these side effects will improve over time. If you find that the side effects are not getting better, it's important to talk to your doctor. If you're not at risk of getting infected with HIV on a regular basis, you might want to consider on-demand PrEP. This means you only take the pills when you know you're going to have sex within the next 24 hours. Some other names for on-demand PrEP are event-driven PrEP, intermittent PrEP, non-daily PrEP, and off-label PrEP. With on-demand PrEP, you follow a 2-1-1 schedule. Take 2 pills between 2 and 24 hours before having sex. Take 1 pill 24 hours after the first dose. Take 1 pill 24 hours after the second dose. For gay or bisexual men having anal sex without a condom, the 2-1-1 schedule may offer protection from HIV. But it's not clear how well it works for heterosexual men and women. transgender individuals, or people who inject drugs. The 211 schedule hasn't been approved by the FDA, which only approved taking PrEP pills daily. The CDC also doesn't recommend the 211 schedule. If you're interested in on-demand PrEP, it's important to talk to your doctor for more information. You can also find resources at the CDC and at health departments and organizations in the US, Europe, and Canada.